All right, everybody, ready for another deep dive? We're going to bust some medical myths today.
Sounds good.
We're talking about medical mistakes that we all make at home.
Yeah.
And I got to tell you, even I learned a thing or two reading this article.
Oh, really?
The biggest medical mistakes people make at home and how to avoid them.
Hmm.
You guys love being in the know, so we brought in an expert to unpack all this.
Well, you know, it's interesting. Even with the best intentions, we can sometimes get things wrong with health issues at home.
For sure, for sure. Like antibiotics. I
Yeah.
mean, we've all been there, right?
Yeah.
You have a cold, you're miserable,
Yeah.
you just want relief, and maybe you even push your doctor for a prescription.
Yeah.
But this article saes maybe we shouldn't be doing that.
Yeah, it highlights that antibiotics are only effective against bacteria, not
Oh.
viruses.
Oh, okay.
And, 9 out of 10 colds are caused by viruses.
So
So in most cases, those antibiotics, they wouldn't even touch the problem.
it's like trying to unlock your front door with a car key. The wrong tool for the job.
The perfect analogy. And, there's the larger issue of antibiotic resistance.
Hmm.
When we overuse or misuse antibiotics, we're essentially training bacteria to become stronger and harder to kill.
Oh, wow.
And that's a huge public health concern with global consequences.
Yeah, no kidding. Okay, so big takeaway, don't bug your doctor for antibiotics. And if you do need them, finish the whole course.
Exactly.
Even if you start feeling better.
Yes, don't give those bacteria a chance to come back.
All right, so let's talk about wound care.
Okay.
Because I was surprised to learn that some of those home remedies that we all grew up with can actually be bad and hinder the healing process.
Yeah, like hydrogen peroxide.
Yeah, I always thought that was the best thing to kill germs.
Right.
But maybe not. What's the deal with peroxide?
Well, peroxide and rubbing alcohol can kill bacteria,
Okay.
but they can also harm the healthy tissue,
Oh.
and that can slow down healing and make scarring worse.
So not good. So I guess you're saying we shouldn't take a scorched earth policy when it comes to wounds.
Exactly. For most minor cuts and scrapes,
Yeah.
soap and water will do the trick.
Really?
Just clean the wound gently,
Okay.
apply some antibiotic ointment,
Uh-huh.
keep it covered with a clean bandage.
Wow. So the best solution has been in my bathroom this whole time.
Yeah, a lot of times the simple solutions are the best.
Yeah. And what about letting a wound breathe?
Oh yeah, that's another misconception.
I always thought that was important.
You might think it dries it out,
Yeah.
but actually the opposite is true.
Wait, you're saying keeping a wound moist is better?
Yeah, it might seem kind of counterintuitive,
It does.
but a moist environment actually allows the cells to migrate more easily and rebuild that tissue faster.
Oh.
So keeping a wound covered and hydrated is key for optimal healing.
Okay, so put down the peroxide and pick up the bandages. I got it. Wow. It's amazing what we did accept without question.
Right.
Now, this next topic is a little more serious.
Okay.
It's about warning signs that we shouldn't ignore.
Right.
And I know I've been guilty of just brushing off symptoms.
Yeah.
But this article highlights the dangers of doing that.
Yeah, it's human nature to downplay things, especially when we're busy or, we just don't want to deal with going to the doctor.
Yeah.
But ignoring certain symptoms can have some serious consequences.
Yeah, the article gives some crazy examples like people mistaking chest pain for indigestion.
Oh, wow.
Or dismissing bad headaches as migraines, or thinking shortness of breath is just being out of shape.
Right. And those could be signs of a heart attack, a stroke, or a serious infection.
Oh, wow.
So, it's important to pay attention.
So how do we know when it's something we can handle at home versus something more serious?
That's where you just have to know your body.
Yeah.
If a symptom is sudden or severe,
Okay.
or just feels different from anything you felt before, that's a red flag.
And I guess if you're ever in doubt, go see a doctor, right?
Absolutely, your health is worth it.
Okay, so let's move on to a hotter topic.
All right.
Temperature management. Remember how our parents used to bundle us up in blankets when we had a fever?
Oh, yeah.
Sweat it out.
Yeah, the classic sweat it out strategy.
But unfortunately, that can do more harm than good.
Right, especially for young children.
So what's the problem with all the blankets?
Well, when you have a fever, your body's already working hard to regulate its temperature.
Yeah.
And those extra layers just trap heat and can cause overheating,
Oh, wow.
which could be dangerous.
Okay, so ditch the extra blankets. Got it. So what's the best way to manage a fever then?
Usually, the right dose of acetaminophen or ibuprofen
Okay.
is enough.
Okay.
And just make sure the environment is cool and comfortable.
Okay.
But be careful about those over-the-counter meds.
What do you mean?
A lot of cold and flu medicines have both acetaminophen and ibuprofen in them.
Oh.
So you could accidentally double up on the dosage.
Oh, wow. Good point. So read the labels, everybody. And if you're not sure, ask your doctor or pharmacist about safe dosages.
Right.
Now let's move on to something I know we all struggle with.
Okay.
Medication storage and management.
Oh, yeah.
I am so guilty of having a chaotic medicine cabinet.
I think most people are.
Yeah, I bet. But this article says most people store their medications wrong.
Yeah, it's true.
Really? How bad can it be?
Well, heat and moisture can actually degrade the medication and make them less effective and even dangerous.
Oh, no.
And where do a lot of people keep their medicine? The
Where?
bathroom, which is
Oh.
often very humid,
So my medicine cabinet is like a sauna for my medications.
not the ideal spot.
Yeah, I can see that. So what about expired medicine?
Hmm.
Can you use it if it's just a little past the date?
It's best not to risk it.
Okay.
They can lose their potency or change chemically
Mm.
and become less effective or even harmful.
So just toss them.
Yeah, play it safe.
Okay. And what about interactions between medications?
Oh, yeah, that's important.
Because even over-the-counter stuff and supplements can interact, right?
Yes, definitely.
So check with your doctor or pharmacist before starting anything new,
Always.
even if it seems harmless.
Absolutely. And keep a list of all your medications and dosages and any allergies you have.
So basically a medication cheat sheet?
Exactly. And it's super helpful in emergencies.
Good to know. So to recap,
Yeah.
we're ditching the bathroom cabinet,
Yes.
we're checking expiration dates,
Right.
and we're being super careful about mixing medications.
Exactly.
What else should we keep in mind when managing our medicine?
Always follow your doctor's instructions about the dosage and how often to take it.
Mm-hmm.
And never share your medication with other people.
Oh, yeah, good point. Okay, so we've covered a lot today, from antibiotics to wound care to fever management and medication safety.
It's a lot.
It's clear that there's a lot more to managing our health at home than we think.
It's about being informed and empowered to make those safe and effective choices.
Exactly, and that's what we're all about here in the deep dive. Before we move on, what's something else that surprised you from this article?
Well, what really stood out to me was the section on...
Oh, cliffhanger. Don't worry, everyone. We'll be right back with more from the expert and more insights from the biggest medical mistakes people make at home and how to avoid them. Stay tuned.
the section on prevention and knowing when to seek professional help.
Yeah.
It's all about finding that balance between self-care and knowing your limits.
Yeah, sometimes DIY just isn't enough.
Exactly. So what can we do to be more prepared at home?
Well, the article talked a lot about having a good first aid kit.
Yeah.
It's one of those things we all know we should have.
Right.
But do we really? Do we keep it up to date? Is it fully stocked?
Yeah. It's easy to let that slip, but it really is essential.
Yeah.
Think bandages, antiseptic wipes, pain relievers, a thermometer,
Yeah.
all the basics you need.
Uh-huh. And it's not just about the supplies, it's also about knowledge.
Yes, definitely. Be aware of any allergies
Yeah.
or medical conditions you or your family members have.
Right.
And keep emergency contact numbers handy.
Okay.
You'd be surprised how many people don't have that information.
That's true. So we've got our first aid kit.
Okay.
We know our allergies.
Right.
We've got our emergency numbers.
Yep.
When do we know that we absolutely need to go to the doctor?
What? Difficulty breathing,
Yeah.
persistent chest pain,
Uh-huh.
severe abdominal pain,
Okay.
signs of a serious infection. Those are all major red flags.
Okay.
High fever that doesn't respond to medication.
Got it.
Sudden severe headache with confusion.
Okay.
Signs of dehydration, unexplained weight loss, or any persistent symptom that just don't go away.
Yeah.
Those all warrant immediate medical attention.
It's good to have that list because I think sometimes it's easy to second guess ourselves.
Right.
Like, am I overreacting?
Yeah, and it's always better to err on the side of caution.
True. Don't hesitate to call your doctor or go to the ER if you're concerned
Exactly.
about yourself or a loved one.
Yes,
Your health is important.
absolutely.
We talked about wound care earlier,
Yeah.
but are there like different types of bandages and dressings for different wounds?
You're right, it's not one size fits all.
Okay.
For minor cuts and scrapes, a simple adhesive bandage is usually fine.
Okay.
But for deeper wounds or burns, you might need a more specialized dressing.
Like what?
Well, there are things called hydrocolloid dressings.
Okay.
They absorb fluid and create a barrier over the wound to keep it moist.
Fancy.
And then you have foam dressings.
Okay.
They provide cushioning and protection for larger wounds
Got it.
or areas with lots of friction.
So it's just like with the antibiotics and the peroxide.
Right,
You got to use the right tool for the job.
exactly. And if you're unsure, your doctor can help.
Good point. This whole deep dive has been great for practical advice,
Yeah,
but it's also been a good reminder to trust your instincts.
definitely.
If something feels off, don't brush it off.
Right. Pay attention to what your body's telling you.
Okay, before we wrap up, I want to talk about something that wasn't really in the article,
Okay.
but I think it's really relevant,
And right?
and that's mental health.
Yes, mental health is just as important as physical health.
For sure. And it's easy to make the mistake of ignoring our mental distress.
Yeah, it's easy to push those feelings aside.
Yeah, especially in our busy world.
Right, but ignoring it can have serious consequences.
So what are some warning signs we shouldn't ignore when it comes to mental health?
Persistent feelings of sadness,
Okay,
anxiety, or hopelessness.
got it.
Also be mindful of changes in your sleep patterns or appetite,
Okay.
or loss of interest in things you used to enjoy,
Uh-huh.
difficulty concentrating,
Yeah.
increased irritability, withdrawing from social situations,
Okay.
and especially thoughts of self-harm or suicide.
Right.
Those are serious signs that you need professional help.
Yeah, and there's no shame in asking for help.
No, not at all.
It actually shows strength and self-awareness.
Exactly. And there are a lot of resources available.
Yeah.
From therapy and support groups to medication if needed.
Yeah, you just got to find what works for you.
Right? And remember, you're not alone.
Yeah, for sure. So many people face mental health challenges.
Absolutely.
Asking for help shows courage, not weakness.
I agree with that. Let's shift gears a bit and talk about caring for loved ones at home.
Okay.
Something a lot of us will do at some point.
Yeah, and the article talked about how easy it is to make mistakes as a caregiver.
Right. One of the biggest is trying to do everything yourself.
Yeah, I bet.
And not asking for help.
Yeah.
It's natural to want to be the super caregiver, but that can lead to burnout.
Yeah. I bet it's hard to admit you need help.
It is. But you can't pour from an empty cup.
Oh, I like that.
So ask for help from family or friends or professional.
Yeah, good advice. What about communicating with healthcare providers?
Oh, that's super important.
Are there mistakes people make there?
Yeah, you got to be clear and concise when talking to doctors and nurses
Okay.
about your loved one's condition.
Uh-huh.
Don't be afraid to ask questions,
Got it.
clarify instructions, and really advocate for their needs.
So be an active participant in their care.
Exactly. Make sure you understand the medication instructions.
Yeah,
And follow them carefully.
that's a good one.
Medication errors can happen easily.
Yeah, especially if they're on a lot of meds.
Right. And caregiver burnout is a real issue.
Yeah.
So set boundaries and prioritize self-care.
Yeah.
You can't provide good care if you're neglecting your own well-being.
So it's all about finding that balance.
Exactly. It takes communication and a willingness to ask for help.
We've talked about a lot today.
We have
First aid, mental health,
a
caregiving.
lot of ground covered.
And honestly, I feel more informed now.
That's great to hear.
Like, I can handle whatever health challenges come my way.
That's the goal. And remember, knowledge is power.
It is. Speaking of knowledge.
Yeah.
What about all the health information online?
Oh, that's a great point. It's like a double-edged sword.
Yeah.
We have more information than ever,
Right.
but it's hard to know what to trust.
It is. I've totally gone down those rabbit holes of online symptom checkers and the medical forums.
Yeah.
And you end up feeling more confused than when you started.
Exactly. And, one of the biggest mistakes is relying on Dr. Google.
Oh, yeah, it's so tempting to self-diagnose.
It is.
But that can be dangerous.
It can. So, online information shouldn't replace professional medical advice.
Right. So how do we use all these online resources wisely?
Well, stick to reputable sources,
Okay.
like government health websites,
Okay.
like the CDC or the NIH,
Uh-huh.
professional organizations like the American Heart Association,
Got it.
or academic institutions like the Mayo Clinic.
Those are all good.
Yeah, those are generally better than random blogs or forums.
Yeah, for sure. What else?
Always cross-reference information.
Okay.
Don't just rely on one website.
Uh-huh.
And if you're concerned about something you read online,
Yeah.
talk to your doctor.
Yeah, good idea.
They can help you figure out what's real and what's not.
Be a critical consumer, especially when it comes to your health.
Exactly. And another common mistake is misunderstanding medical jargon.
Oh, yeah, for sure.
The language of medicine could be confusing.
Oh, totally. I've left appointments feeling like I need a medical dictionary.
Yeah, so don't be afraid to ask your doctor to explain things in plain language.
Yeah.
It's their job to make sure you understand.
It's about advocating for yourself.
Yes.
And making sure you understand what's going on with your body.
Exactly. And I want to emphasize how important it is to follow up with your doctor after an appointment.
Why do you think people skip that?
I think sometimes people think once they've seen the doctor and gotten treatment, they're good.
Yeah.
But follow-up appointments are important
Yeah.
to monitor your progress,
Okay.
adjust treatment plans,
Uh-huh.
and address any new concerns.
So it's about keeping that communication open.
Exactly. And you can always reach out to your doctor between appointments if something changes.
That's good to know. So we've learned so much about avoiding medical mistakes at home.
We
I
have.
feel more informed and prepared to make healthier choices.
That's great.
And I really appreciate how you connected all these mistakes to the bigger picture of taking control of our health.
Well, it's all connected, and you are your own best advocate.
That's true.
So never be afraid to ask questions.
Okay.
Seek second opinions.
Uh-huh.
And stand up for your needs.
Good advice. Okay, so before we wrap up,
Yeah.
I want to leave our listeners with a question.
Right.
Think about your medicine cabinet, your first aid kit, your overall approach to managing health issues at home.
Okay.
What changes will you make now based on what we learned today?
That's a great question. It's all about putting this knowledge into action.
Exactly. It's not just about listening. It's about making those changes.
Right.
It's amazing how much we just kind of take our health for granted. We think we know what we're doing.
Right.
And then a deep dive like this,
Yeah.
you realize all these little things that can make a big difference.
It's true. Sometimes the smallest changes in our habits
Yeah,
can have huge impacts on our well-being.
I agree. Which makes me think about aging, because that's something we're all going to face.
Right.
And this article made me wonder if our approach to healthcare should change as we get older.
Yeah, that's a great point. Our bodies change as we age,
Yeah.
and we can become more prone to certain health problems.
That's true. So, like, it's normal to get aches and pains.
Yeah,
But how do we know when it's just aging or
right.
something more serious?
That's where being aware and having a good relationship with your doctor is key.
Uh-huh.
Don't just chalk it up to getting older.
Yeah.
Pay attention to your body.
Okay.
And if something feels wrong, get it checked out.
So be proactive.
Exactly. Early detection is so important for so many health issues.
Yeah.
And that becomes even more important as we age.
Like, we need to develop a sixth sense about our health as we get older.
I like that. Listen to those subtle cues.
Yeah.
And don't be afraid to speak up.
This deep dive has been a lot of information.
It has.
We've debunked medical myths.
Yeah.
Talked about caregiving, digital literacy, and our health.
A lot.
I need a notebook for all these takeaways.
I know, right? But just focus on those small steps
Yeah.
you can take to improve your health habits.
Okay, so ditch the peroxide.
Right.
Organize my medicine cabinet.
Exactly. Little things can add up.
I like it. And, knowledge is power.
It really is. The more you know about your body,
Yeah.
the better you can take care of it.
I think that's what I've learned from this conversation.
Yeah.
It's not about being a medical expert. It's about being aware,
Mm-hmm.
thinking critically,
Yes.
and
Yeah.
asking questions.
Absolutely. Advocate for yourself.
Okay, so as we wrap up this episode,
Okay.
I have a little homework assignment for everyone listening.
Okay, I like it.
Think about one thing you learned today that surprised you. What's one little change you can make to be healthier?
That's a great challenge. Small steps lead to big changes.
And you don't have to do it alone.
Right.
Talk to your doctor, your friends and family.
Yeah. Keep learning.
That's what we're all about here, for sure. Well, this has been an awesome deep dive.
Yes.
We feel so much more informed and prepared.
I'm glad to hear that. Remember, knowledge is power.
It is. Thank you so much for all your insights today.
It's been my pleasure.
Everyone stay curious, stay informed, and take care of yourselves.
Absolutely.
We'll be back soon with another deep dive.
Until next time.